everyone, I'm Dr. Sally Foote, and welcome to my Facebook Live. I am a veterinarian with over 30 years of veterinary general practice experience, and I'm also an animal behaviorist. My focus is on low-stress veterinary care, low-stress handling, and also helping clients as well as veterinary practitioners to integrate veterinary medicine with animal behavior so we can improve the whole exam experience and taking care of our animals at home. Hi everybody, glad to see you joining. Well, today's topic, I have here the first summary page. I'm actually going to break down this AAHA's. This says AAHA's Senior Care Guidelines for Dogs and Cats. So the American Animal Hospital Association publishes numerous guidelines to help establish kind of best practices for us in veterinary medicine. And so this is a new recent guideline that has been published. I'm going to take a couple of these different Facebook Lives breaking down this guideline because it's pretty big. And oftentimes, I just know myself in practice, when I hear about a new AAHA guideline, I think, oh, that's great. And then I'd see how big it is and go, oh my gosh, how am I going to go through this whole thing? And make sense of it for how I apply it in my everyday life at practice. So I thought, I'm going to break this down, and especially with an eye for animal behavior. How changes in behavior in those senior years comes into play with their health care and helping clients to understand and to know these small changes in behavior, especially, I'll call them the golden years, the senior years for our dogs and cats, can actually be the first kind of warning sign or indication that we may have another health problem going on and that we want to help our pets, especially catch these things early, because it really improves the quality of life of the pet and the quality of life with the owner. We define senior pets, most are defined by the dog who is over 7 years of age and the cat is over 9 years of age. Now, our dogs and cats are living so much longer. When I graduated from veterinary school in 1984, a 10-year-old German Shepherd or Golden Retriever was considered geriatric. There was oftentimes where we had chronic pain, from hip dysplasia or lumbar, arthritis in the lumbar spine, or we were seeing, the other aging signs, early kidney disease, etc. And we did not have nearly the medications or understanding to how to manage these aging conditions in these animals. Secondly, nutrition has greatly improved. And this is from the four main manufacturers that I'm talking about, who have really helped to create the life stage feeding, life stage nutrition for our dogs and cats, as well as when they do have a health condition, that we are able to address it and help manage it nutritionally, which really increases their lifespan with a high quality of life. So senior care, 44% of our pet population is in the senior category. And yes, I definitely agree with that. In practice, I've recognized pretty quickly, it's our middle-aged to senior pet that we see most often. They spend many more years in that life category now. A 7-year-old dog can often live to be 14, maybe even 16 years of age, even as a large breed dog, like a Labrador or a German Shepherd. Well, that's, half their lifespan is going to be in the senior year. So that's why we want to have a focus on this. That's why this has been written. Okay, the first page, if you go to the website there on AAHA, and I've shared the link in my Facebook page. I'll share it again with this. You're going to come up onto this. It's kind of a summary page. And what I do like how AAHA is presenting this now, because it really helps it to be categorized, helps you to think, in these like sections, even just as overall overview. So first of all, we're going to start with, to recognize that senior care is multifaceted, and it will include medical and interventional therapies. So meaning we're going to be doing blood work, and we're going to recommend changes of diet or medication or supplements to focus on that specific physical health. And I think a lot of those of you out there in the audience who are veterinarians or veterinary technicians, in the veterinary field, we pretty much know a lot about that, and we're pretty well, versed on that. Now, behavior management. This, I feel, is what's lacking a little bit in our awareness or knowledge of managing the senior pet behavior. So I'm going to cover a little bit of that, and as I said, I'm going to do some other presentations to be a little more specific, but it's in the guidelines. Want to think about behavior management in these senior pets. Third, awareness of comorbidities. So, all right, you got skin problems, your early renal failure, your thyroid's low. Those are 3, and maybe early arthritis. Those are 4 comorbidities. So we're going to have to balance all of those. Remember to keep those in balance. And lastly, environmental modification. It's kind of a big word for how is the house set up? What kind of flooring is in that home? What does it take for this dog to go from the family room outside to go to the bath, to urinate or to defecate, and then back in again? How many stairs do they have to go up? What is the flooring like? Are they able to do it or not? Are there any ways we can modify this? Same thing with our cats. How are they able to get up on their perches now? If not, have we moved or can we move some furniture around or little end tables to do what I kind of call stair stepping up and down, onto the perches so they can get there? What are the resting places like, etc.? Okay. Now the second little category on this sheet says to plan ahead for senior pet appointments. So scheduling the extra time. So clinics, and I know we've had a lot of changeover with some practices going from independent ownership into more consolidated corporate ownership. So there may be some just standard, everybody gets a 15-minute appointment, etc. Yeah, when it comes to our seniors, and so this is a little bit about the customer service representative with the practice managers, but we really should be planning half-hour appointments. Go ahead and charge for it. But when you see this pet is older, because we have more things we need to review with these clients and also for the sake of these pets. So schedule extra time, discuss the expectations and progress with the clients. So realistic expectations for how we can help manage not only the health, but maybe managing some of the behaviors, some of the changes in the home, etc. We're going to need to schedule a little extra time for that. And then having handouts and resources available to support our clients. There are lots of different places you can get some various handouts. The two handouts I think that every pet owner should have at different points in life, but certainly senior years. One is, this is a Colorado pain scale. Okay, so you can get this off the internet from the Colorado State University. So this is a canine pain scale, and it shows the body language as, from very low as it's going up. I think it should also be blended with the canine ladder of aggression. This is a canine ladder of aggression. You can get this off of my website or Dr. Kendall Shepard, DVM, and this is how dogs show those early signs of anxiety and rising up and shifting over to aggression. Now, the reason why the two of these should go together is oftentimes when pets have mild, moderate, or severe pain, they're going to show an increase or even development of these signs of anxiety going up and shifting over to aggression. Pain-triggered aggression is a diagnosis. So, and that they can go up at how this, how the scale works. But, here's an example. It's why I feel this is so important. At my general practice at my Oka Vet clinic that I owned for many years, I had, a general annual exam of a nice older German Shepherd mixed dog, about 10, 11 years old. And Dad was there, and he has 2 young children, about 3 and 5 years of age, with him on the checkup. And I'm examining the dog, and, I just learned to put the question to clients as, so is there anything your dog is doing different that kind of drives you crazy? Or, just is different? He's like, oh no, he's fine, or he just, I don't know, he gets a little grumbly at the kids now. That's what he said. He gets a little grumbly at the kids now. I said, oh, when or what's going on? Oh, I don't know, it's not a big deal. Remember? Just don't realize growling is a big deal, but stay in the conversation. Okay, listen to what the client says. Oh, it's not a big deal. I didn't respond to that, but I just said, and he said, it's when the kids run past the dog in the hallway, when they're now being active, the dog's laying around in the living room. I said, okay, well, a lot of dogs, at this age may have some back pain, some body pain, and that can aggravate or increase them not wanting to get bumped into, or noise. They can be more sensitive about noise. So I suggested possibly doing x-rays on him. He is a breed type. I said that, oftentimes we'll have arthritis in the back of the spine or the hip. The man acknowledged that. they'd fallen off of being on their joint supplement. And as I continued the exam, I also noticed that there was some redness above the upper fourth premolar on the left side, and inflammation there, and the dog seemed a little sensitive touching it. So we scheduled the dog for dentistry. I went ahead and he got back on the joint supplement. I started a non-steroidal anti-inflammatory. We drew the baseline blood work. Everything was normal, and for anesthesia as well as aging. Did a dentistry. Turned out he had a slab fracture in that upper fourth premolar. He'd been eating fine. His weight was normal, playing with his toys because he's using the other side of his mouth. Anyhow, did the dentistry. Dog went home. I gave the man advice as far as let's put up a baby gate, the dog away from the kids, etc. So I called him 2 days later after, the dentistry, see how the dog was doing. Oh, dog's doing fine, eating fine, etc. And then I said, well, how are we doing with the growling at the children? Are you following the plan? Oh, his growling stopped. We don't need to do any of that stuff, he said. I said, oh, and he goes, yeah, I really think that tooth bothering him was why he was starting to growl at the kids. And I said, that's very likely true, yes. Now, he may also have still some difficulty with his back, and we'll at least keep him on the joint supplement. But that right there really pointed out to me a combination of the primary change in the dog's behavior was increasing anxiety about the children bumping into him from the pain, and it showed as a growl. Also, how we asked the questions. We needed to be very open-ended, and I'm going to just frankly say, do not use the words aggressive. Don't use the word behavior, because a lot of people still think of that as, big problem, and you'll probably get a lot of no, that's not an issue. So make the question open-ended, be kind of a little lighthearted, like, hey, anything he's doing is driving you crazy or seems weird or different or just off. Make it that way. You'll get a heck of a lot more information from your clients, and you can then it will help to lead to, figuring these things out. Okay, so have the canine ladder of aggression, canine body language of pain, pain scoring from Colorado, and feline, of course. We want our cats to be recognized for pain as well, or changing anxiety and aggression. So this is the Colorado pain score for cats. How cats will show changes in their body language, and pair it with, this is my feline ladder of aggression, which is available on my website. Yes, I updated my website to make sure the link's working right. But I'll go to drsallyjfoote.com under the veterinary resources tab, and you can find this. And again, look at the two of them together. Now, in this information from AHA, especially as we're looking at how cats, show aging differences a little, like behavior aging differences a little bit different from dogs. In cats, we definitely see increase in anxiety. Now, what does that mean? It means cats can be hiding more. So again, when we ask our feline clients, hey, is anything different? Anything your cat's doing that bothering you? Anything kind of changed? You hear them saying like, he's just being grumpy again. Okay, that's that feline anxiety going up to the hissing and the swatting, or I don't know, I think she just, likes to sleep more. She's under the bed, or she lays on the master bed most all of the day until the kids go to sleep. I had somebody else tell me that. Until the children go to sleep at 10 o'clock at night, then the cat will come down into the family room or whatever and be with the adults. And then, okay, it's the noise and activity of the children that your aging cat wants to avoid. And it's probably because, remember, 90% of our cats over the age of 9 have evidence of arthritis in the elbow, the lower lumbar spine primarily, but we have arthritis as a leading problem. Chronic renal failure, early renal insufficiency also causes an increase in ammonia in the bloodstream, which then causes the skin to be more sensitive to touch, which is why they may now hiss or suddenly move away or flinch or swat if they're getting repeatedly petted. So if your client again says things like, oh, he's just being cranky, oh, I don't know, he just doesn't like being touched, or laying on the bed and avoiding things, that is a clue that, okay, we are aging, so we're going to want to investigate certain things, and then also make your recommendations for increasing the number of perches and make sure it's easy for the cat to get up there. I call it hitchhiking. Let's move like the ottoman or the footstool next to the sofa table so we can get up on the sofa table. You can look at the suction cup window perches, move them a little lower, okay? Or how to get up, but how to help the cat Get on these other perches and away from things. Give them a heated bed. There are even some of these beds that have reflective lining for both the dog and the cat that can help them, you know, retain their body heat, and that helps them to feel better. So, and that gets into what we're calling the home, you know, the home changes or environmental modification. Now, the last thing on this first page recommends that we have an end-of-life care section on our website. Yes, we need to meet this full on, right? What is one of the most leading questions, you know, we get from clients as their pet's age is, how will I know when he is in pain? How will I know when he's really declining and I don't want to make him live longer because that's selfish, right? We hear those questions, or maybe we don't hear them, but we start to lead the conversation, and then they will share that with us, which is frankly foremost in our client's head. So if we have things on our website that clearly address this, we put on our website the links to the quality of life scoring system, or we say, yes, aging is normal, these changes are going to happen. Here's how we can help you with managing them. This is what to expect. This is what we have to offer. So have that on your website. One of the notes here is make sure your senior pets are at least 30% of the visual content on your website. So the photographs and pictures we use, we want to include our gray muzzled dogs. We want to include that kind of slightly thin older cat, because it's identifying 44%. You know, we now have people can identify, oh, you take care of those older pets, you know, because that's 44% of our patient population. And show videos of the senior-friendly changes your practice has made. Okay, so now this gets to how we've set up our clinic, especially for low-stress veterinary care and low-stress veterinary care adapted more to that senior patient. I'm going to be making a couple more videos. Please watch my YouTube channel about this. I already have a few up about low-stress veterinary care for the senior cat. But show how, maybe you got the side entrance that only has one step to go up, and it's a shorter walkway from the parking lot to get into the first exam room. Okay, that would make it really easier on that old German Shepherd or Golden Retriever or St. Bernard that needs to come in, right? How we encourage the client to wait in the car with their kitty, their cat, and the carrier, and then kind of like curbside. Then a staff person is going to come out, put a blanket over the carrier so everything's nice and quiet and doesn't startle our older cats so much. And we bring them in and we show them setting them on the exam table with a blanket or a towel on it, and we do the full exam in the exam in the exam room. We are not taking them back to the treatment area where it's so noisy and so congested and everything else. Show how you are doing this, the low stress technique for in-carrier blood draw, or having the older dog standing on the yoga mat and putting lidocaine cream on, say, the back leg for doing a tarsal lateral saphenous blood draw. Show those things on your website. That shows how you're accommodating the older pet. You can do your own video and put it up there. You can hire somebody to do that for you. But these kinds of little things make a huge difference when caring for these senior pets. If we make it less stressful for the pet to come in, the client will bring them in. Secondly, we can also now tell the client how to do some of this, you know, care at home, and it really shows how you care. There's a lot, like I said, on that AHA website underneath here, which is good. Okay, there's some other handouts about cognitive dysfunction syndrome. Also, the just different ways of how to put all these things to use on the website. So I'll be having a few more Facebook Lives. I really appreciate you, being here on the Facebook Live today. Put some comments. How do you make accommodations at your place of work, or would you like to, for helping our older cats to be able to receive an examination and be more comfortable, our older dogs, as well as for our clients, how we can have handouts, maybe some of these video links and things to show clients to just help make those senior years a bit better for them all. Thank you so much and have a great day.